Good Samaritan Medical Center, an SCL Health hospital located in Lafayette, Colorado, is a state-of-the-art facility caring for the healthcare needs of the surrounding community. Good Samaritan is designated by the state of Colorado as a Level 2 trauma center and is verified by the American College of Surgeons. Built in 2004, Good Samaritan recognized the healthcare needs of this fast-growing community in the northern metro region. Since its inception, it has rapidly grown from a Level 3 community hospital to the Level 2 trauma center it is today. Offering the best in medical and surgical technology, Good Samaritan staff make it their mission to be the best part of your worst day. When seconds count, the teamwork we provide from the ambulance bay through the emergency department, operating rooms, and intensive care unit areas make a difference in our patients' outcomes.
Since we have become a trauma center, especially a Level 2 trauma center, it's been a great thing as far as relationships with our ED physicians and trauma surgeons to collaborate along with our orthopedic surgeons and neurosurgeons, all the people that help us take care of our trauma patients.
We have a strong team of highly skilled individuals, from our nurses to our emergency room techs, to our physicians, pharmacy, respiratory therapy, and we all work like a well-oiled machine here.
We greet all trauma team activations on arrival. We have a really good relationship with EMS, so EMS will call us, give us the report, and then the trauma team assembles in one of our trauma rooms.
Our trauma rooms here are set up to take care of the sickest trauma patients. We have different equipment such as the Belmont, which is to rapid infuse blood, monitoring equipment, which is able to give us real-time feedback of how our patients are doing. Trauma lockers. These give us equipment readily available for airway, breathing, and circulation, all at our fingertips, so we're not having to run around and find things. It just helps us to be more efficient.
We work closely with our EMS leaders and paramedics on all of our cases, not just trauma, but I think trauma leads that for us. They give feedback to us as far as their reception here in the emergency room.
Our trauma nurses are able to participate in different routes of education through certifications, running mock traumas, and also attending trauma conferences.
You never know what you're going to get when somebody rolls in. My very first trauma here at Good Samaritan was actually an airplane crash, which I was significantly concerned about as I'd never dealt with an airplane crash before, but you have to be ready for everything.
We want everyone to feel part of a team. We want success in the outcomes of our patients. And so we want to make sure everyone feels comfortable coming up to us, whether you are another physician or a provider in the operating room. Whatever role you may play, we want to make sure that we're here for you.
Part of why trauma is so intriguing is because you do have to provide the breadth of trauma services to everyone throughout the body, not just one isolated surgery that you do over and over again every day.
We've been doing this for quite a long time, where we round pretty much every day with the ICU nurses at the bedside. We talk to, and we even include families in that discussion at times. It's multidisciplinary in the fact that we have nutrition there, we usually have therapy there, respiratory therapy, occasional physical therapy, as well as the charge nurse and the whole team.
So we all participate in what we call multidisciplinary rounds, where we kind of go through this big checklist on, is there anything we're missing, is there anything we can do to care for this patient.
We definitely collaborate with a lot of different surgical subspecialties. We work with orthopedic surgery, neurosurgery, nephrology. We also collaborate with our hospitalist colleagues because quite a few of our patients are geriatric and need additional support from the medical side.
TNCC and TCAR are both classes that we do take and implement in our daily care for our patients.
This hospital is dedicated to taking care of the trauma patient, and it's encouraging, it's optimistic, it's great.